Hello, everyone, and welcome to another installment of the Advisory Health Council's Wellness Spotlight. Today, I'm very pleased and honored to have as our special guest Dr. Jason Deitch, the co-author of the national best-selling book, Discover Wellness: How Staying Healthy Can Make You Rich. Jason, welcome to the Wellness Spotlight.
Thank you, Dr. Ken. I appreciate it.
Jason, what made you write this book?
Well, it was about a 2-year labor of love once we actually put pen to paper, so to speak, or these days, finger to keyboard. You know, as a doctor in practice for about 9 years or so, I really found that people would be coming into my office what I thought of as was too late. You know, day in and day out, we would be working with people, myself and my co-author, after we kind of had conversations about all of this. We found that there were just too many people that would let themselves get sick due to an unhealthy lifestyle and then come in with expectations of getting fixed quickly, so to speak.
Patched up.
And it just became unrealistic for them, and it became very frustrating for us as doctors. So we really wanted to do what we can to see what we can do to really transform our healthcare system from the sickness care system that it is into a real, true, authentic healthcare system, a system that focuses on the promotion of health and well-being. And we figured the best way to do that would be to try to really illustrate what our present healthcare system is about, what the healthcare crisis is all about, and what opportunities people have to, in fact, take control of their health, understand the possibilities and incentives they have to get and stay well and to make better lifestyle choices.
Now, you used the word crisis a minute ago. The healthcare system that we have in the United States, we like to think of our system of healthcare, we like to think of everything that we have in the United States as being the best of everything.
Yeah.
So for you to, as a wellness expert, to say that our healthcare system is in crisis, what does that mean?
Well, there are a few people, I think, today that can argue that we are number one. As much as patriotic as I am and as nationalistic as I'd like to believe that America is the best at everything, unfortunately, the World Health Organization ranks America, ranks our healthcare system as low as 37th. There are third world countries that have better healthcare ratings than we do. In spite of that, we actually spend more than 2 times the amount of just about every other country. And America makes up approximately 5% of the world population, but consumes over 50% of the medications in the world. That said, if we're spending all of this money and we're focusing our attention on all of what we think of as solutions, and our outcome is very low healthcare ratings compared to the rest of the world, we find ourselves in a situation where we're not getting our money's worth, and in fact, people aren't getting healthy and well. America spends over $2 trillion a year on what we call health care, but is in fact a sick care system. And I don't think that there's many people that could argue that we have the best system in the world anymore. We may have the best technology, we may have the best trained doctors in the world, we may have the most compassionate staff of people that want to serve and help people, but our present system, the way it's working, is not producing the best results.
Why do you call our system a sick care system? When people go there and they feel sick, but they seem to feel a lot better when they're done with their care. So why do you call that a sick care system?
Well, you know, if you went to a medical doctor and said, I feel great, what can you do for me? In most cases, there's really not a lot that they can do. They could run some tests, they can check to, you know, see if you have an early sign of a disease, but our present medical system is not focused on the promotion of health and well-being. It's really focused on the detection, diagnosis, and treatment of disease. Well, disease is a sickness. It's very good at focusing on critical emergency care. It's wonderful once you have a disease at trying to understand what it is and come to diagnosis. But it's really not accurate to call it a health care system because it doesn't really promote health. It helps people who are sick and diseased by using the treatment of drugs and surgery.
How do you think it got to be this way? How did it evolve to this point?
Well, we really illustrate in the book. I mean, that's much of what we talk about. You know, we could go on for hours, to be honest with you, talking about that. But in reality, there's just a strong financial incentive in the treatment of disease. The pharmaceutical industry for over a decade now has been oftentimes the most profitable industry in the world by far.
It's the biggest industry in New Jersey.
Is it? Yeah. So there's a lot of money in sickness. There's not a lot of money in health. And we do live in a capitalistic society. And unfortunately, most people don't take the time enough to really understand what's going on. We are bombarded by commercials, by news reports, by magazines, everywhere, that really instills a sense of fear in the American public about what has been called by many medical doctors the medicalization of health, of America. And I'm hoping and I believe that the pendulum is swinging. There are a lot of new books actually written from the medical community that are really illustrating and bringing to light the abuses in medicine, the misunderstandings of what is claimed to be scientific, but oftentimes with a little bit more research isn't actually what it claims to be, the misincentives in the system, the fact that doctors don't get paid to keep people well or keep people healthy, they get paid to treat people when they're sick and diseased. Medical doctors will complain clearly and do that there's not an economic incentive. They don't have enough time to teach people about health and wellness and well-being. They don't get reimbursed to teach people about health, wellness, and well-being. It's not a system that does promote that. And as a result, people I think are left very confused.
Now, your book claims to have the ultimate solution to the healthcare crisis in America today. Mm-hmm. How can you make that kind of claim? Yeah,
it sounds somewhat of a bold claim, and I'll clarify. You know, in simplicity, the ultimate solution to our crisis is very simply to have more people less sick. I mean, we spend over $2 trillion a year, which is tremendous. I mean, that's like 5 times the amount that we spend on Homeland Security. I mean, that is an astronomical number. As I mentioned before, it is more than 2 times any other nation in the world. And oftentimes those other nations
are healthier than us.
Well, not only healthier, but they will cover 100% of their population. We spend over $2 trillion and still have 45 and some say 47 million people uninsured. So we're spending plenty of money on the system. I don't believe the solution, as some suggest, is giving more access to more people to more drugs and surgery. I don't believe that solves the problem. I'm not saying that those who need it shouldn't have access to it. What I am saying is that the cause of the problem is the amount of people who need medical care for the length of time they need it. And the primary reason, over 70% of our healthcare dollars today are spent treating lifestyle-related, preventable chronic conditions. And that's an unsustainable trend. We've got 78 million baby boomers over the next 20 years that are going to be dependent on Medicare, meaning our tax dollars, to fund the, again, quote-unquote, healthcare system. With the amount of people that are allowing themselves to suffer from chronic disease, that go in and have to live on medications for the length of time they do, it's unsustainable. The ultimate solution to that problem is to try to teach people to have healthier habits so they can be healthier, not require as much medical attention. And I believe that if we can have more people discover wellness, so to speak, and be encouraged to choose better health through better living, so to speak, that we will have more than enough money to take care of those people that are in truly need.
Now, from the time that we were little kids, our mothers and fathers, the people who influenced us in our lives, they told us how to take good care of ourselves. It was common knowledge. They told us to eat right and to exercise and to get our rest and to think good thoughts. And you mentioned a lot of that in the book. How come we have to teach people about this all over again? How come they didn't get it the first time?
Well, you know, I actually think most people actually have a good sense as to what they should do. They're just not doing it. And I think that's really what makes this book unique and different. There's really, I don't think, any scientific discovery that has to happen to all of a sudden realize what we need to do to have more people be healthier. If you could put in a pill the benefits of exercise alone, let alone all of the others, I could practically assure you that there would be government mandate that everybody would have to take that drug because of the positive benefits on people's health, mentally, physically, in every way, of just exercise, let alone the other 7 different types of ways in which people can promote and improve their health. I think, again, this concept of medicalization, this concept of people living in fear of disease, people going in to be diagnosed early for biometric issues, that primarily the pharmaceutical industry has created disease. And this isn't just me trying to make this stuff up. I mean, this is what the medical literature says, and there's a movement and trend within the medical community about how we expand the definition of what disease looks like so that we can have more people need more medicine, more drugs. And I believe if people became more aware of that, if they would kind of wake up a little bit and realize the economic impact that that's having on all of us, which is really the premise of what we're talking about in how staying healthy can make you rich. I believe if more people understood the economic devastation as well as the economic opportunity, we would slow down a little bit, take better care of ourselves, take better care of our families, and be more proactive. And in the process, we would save hundreds of billions of dollars.
It's challenging for most people to be able to wrap their mind around what hundreds of billions of dollars looks like. And I remember, Jason, from reading in the book, you quoted some amazing statistics about how much Starbucks pays for coffee and U.S. Steel pays for steel, and what illness costs each and every person within the United States. Could you elaborate on that a little bit?
Yeah, absolutely. At the time of when we wrote the book, which now is about a year ago or so, the most recent research at the time was that we are spending $6,280 for every man, woman, and child per capita. For each individual was spending over $6,000 per person on basically, again, our medical system. Recent research actually suggests that that's over $7,000 for every man, woman, and child. Now, I know I didn't spend $7,000 last year on health care, nor did anybody in my family. So that means that there are people who are spending tens of thousands of dollars. And the reality, again, is just it is bankrupting our country. In fact, last year on one of the major news programs, the Comptroller General of the United States, which is the top accountant of America, the guy who basically runs all of the accounting for the country, has been going around America doing what he calls a fiscal wake-up tour. His Comptroller General, his name is David Walker, and he is extremely concerned about the economic impact of Medicare, about our health care system, along with other issues. But the reality is that the financial trend that's taking place right now absolutely threatens to bankrupt our nation's economy. And his words were that if things continue on the trend that they are, that in years from now, it will take our entire tax base and all of the revenue from taxes simply to cover the interest on the money to pay for our health care system, which is just mind-boggling.
And this is what the top accountant in the United States says.
Yes.
This crisis, I also remember reading that it's the #1 cause of personal bankruptcy filings.
It is. In fact, Harvard University put out a study recently that said that over 50% of all personal bankruptcies in America are related to medical debt. People like you and me that work hard, that have jobs, some that work for large corporations, some that are self-employed, find themselves with a health condition. They go to the doctor as they were told and as they were taught. They find out that they have a chronic disease. Chronic disease doesn't happen one day when you wake up. You earned this over many years, oftentimes due to neglect, because as I oftentimes think, to make the metaphor real, people think that they're too busy driving to stop for gas, which you kind of go, well, that's ridiculous. So when people kind of say, I can't make time to exercise. I can't make time to eat properly. I can't make time to go to my wellness doctor and to take care of myself. It's like saying, I'm too busy driving to stop. That's insane. If you don't take the time to fill your tank up, you're not going very far.
If you don't make time for wellness, you're going to have to make time for illness.
Well, that's exactly kind of one of the metaphors. You can make time for wellness now, or you can make time for illness later. You choose. So it's a major source of bankruptcy for America. And there's actually recent articles to go even further in terms of the national impact of all of this. You mentioned Starbucks spends more money on healthcare than they do on coffee. General Motors spends more money on healthcare than they do on steel for their cars. Wow. And even airlines are spending millions of dollars on extra fuel because of the weight of people, the increased weight over people. And so, recent research suggests that if people would lose more weight, we would save money on fabric for extra bigger clothes. We'd save money on fuel for our cars. We'd save, we want to do something good for the environment. It really has tremendous impact all the way around.
How do you define wellness, Jason, and how is it different from healthcare?
There's really two definitions of wellness. One's a personal definition, and the other one's more of an institutional or wellness care model. On an individual basis, we basically say that wellness is a state of health, primarily as a result of your own effort, meaning it's something you create by the choices that you make. It's an outcome, it's a byproduct of the choices you make in your daily life.
Now that's a very interesting distinction, because most people think, or many people think, I won't say most people think, but a lot of people think that only lucky people are healthy.
That's right.
They don't think that they can actually have an impact on their own health by choice, that it's either genetically determined or it's environmentally determined, right, or they're almost victimized from physical, chemical, or emotional stresses, and it's beyond their control.
Yeah, that's exactly the problem. And that's exactly why wellness is so important, is because health is a byproduct. Again, not to not acknowledge, because I know that there is going to be skeptics and cynics who go, yeah, but what about if you have a genetic predisposition? Yes, there are those realities, but it's a very small percentage relative to the total population. The majority of diseases, the majority of conditions are lifestyle related, and wellness is the state of health that you're able to achieve as a result of your deliberate effort. On the other hand, also, we say that wellness is an approach to healthcare that focuses on not only the prevention of disease, but most importantly, the promotion of health and well-being. So I don't like when people misinterpret what the point of what I'm trying to say is. Not that medicine and drugs are a bad thing, they're a wonderful thing. They save lives in certain circumstances. There's no question about that. But they don't create health. If you give a healthy person medicine, it's most likely that a healthy person would become sick as a result of taking drugs. Okay? And we all have this sense that you shouldn't take drugs unless you need them. And that's true. In fact, people abuse drugs on a variety of levels, children especially these days, unfortunately. But a wellness system, a wellness healthcare system, a wellness care system is really focused on creating a team of professionals that can in fact help you promote and improve your health and well-being. And anybody at any age, at any level of whatever health they have, can improve what that is.
Well, frequently medical doctors practice in teams. Mm-hmm. Obstetricians, gynecologists, pediatricians, rheumatologists, orthopedists, neurologists, and so on.
Yes.
Isn't that what you're talking about?
Yeah. In fact, we have an entire chapter that really tries to illustrate this concept of creating a wellness team. And it looks something like this. People generally don't wake up one morning and kind of go, I really don't feel well today. Let me see. I wonder if I should go see my oncologist or my neurologist or my orthopedist or let me see. My friend told me about this guy. That's not the concept whatsoever. They go, I don't feel good. I'm going to go to my doctor. Knowing that the doctor's role is to assess their condition, make recommendations for medicines, and make referrals to specialists. And what we're proposing in this book really is an emergence of a new type of doctor, what we'll think of as a wellness doctor, who is the same type of portal to the world of wellness. Somebody that people can wake up one morning and go, it's time for me to actually take my health to the next level. I want to raise children who are as healthy as they can be so they can minimize and reduce their risk of having these types of chronic diseases, perhaps that my parents are suffering from right now. So I want to find a wellness doctor, and we actually talk about how to find one, what questions to ask, how to know if you're finding the right type of wellness doctor or not. We make suggestions as to what types of professionals you can work with. But that's really the vision, I think, of the new healthcare model, is to find somebody who can help people really create a wellness lifestyle. Somebody who provides their basic care, somebody who makes recommendations for what wellness products, supplements, exercise equipment, what things they should be taking, buying, and using to promote their health and well-being, and what specialists they should see. Pilates instructors, yoga instructors, personal trainers, life coaches, people that will help, massage therapists, chiropractors, I mean, the list goes on. People who can help promote your health and well-being in an effort to not only live the greatest quality of life that you possibly can, as we imply with the book. Richness is having the freedom you want in your life. You create that. But it's also doing your best to reduce your risk of medical bankruptcy, reduce your risk of chronic disease, reduce your risk of being dependent on, quite honestly, oftentimes dangerous medications and surgeries that can have fatal outcomes. You know, there's a lot of people that go to the hospital and end up in much worse shape than before they even got there. I mean, hospital infections and so on. So I just think it's time for us as consumers, as people, as Americans, to say, okay, we're number one. Like, let's do something to, in fact, achieve that level of perception that we have for ourselves. And creating a wellness team, I think, is a perfect model for our future.
What country today do you think offers the closest system to this type of system that you're talking about?
Well, I guess you'd have to look at the statistics. I mean, you've got to look at you know, Sweden and Norway and Denmark as those countries, because they are the highest, they were the healthiest countries that there are. What I'm careful of, because again, I'm sensitive to how people perceive what these questions may imply, is that you know, just because everybody has free access to free health care is not the reason they're the healthiest. In fact, you know, one of the healthiest countries in the entire world is a small town in the Pyrenees Mountains between Spain and France. And I believe, in fact, they are the healthiest country in the world. Now, I would suggest to you that the reason they are as healthy as they are is not because they've got the best drugs, the best MRIs, the best technology. It has to do with their lifestyle and lifestyle choices. Fresh air, constant exercise, natural foods, happiness. I'm sure sexual activity has something to do with all of this. I mean, these are the things that actually help promote health and wellness and well-being. And you know, our country's not really into all of that stuff. Most people are overstressed, underloved, underpaid, underappreciated, depressed, frustrated. You know, we live in a very tight pressure cooker across America. So I think looking at some of these countries, not necessarily because they offer free health care, so to speak, or free medical care to everybody, I think that there's some controversy both ways on that. But ultimately, because of their lifestyles, they achieve, and the statistics prove it, there's nothing to argue. I mean, the results are what the results are.
For people who want to get started and take more control of their life and be healthier, to have more wellness, where do they start? Do they start on their own? Do they consult with somebody who can help guide them? And if they decide that they want some professional guidance, how do they know who the right person is to start with?
Yeah. We try to explain that in the book in terms of what types of doctors you can see. Now, there's a variety of different types of doctors that can help people, clearly. We believe that chiropractors, naturopaths, medical doctors that are holistically oriented, that are focused. I mean, it's not so much your training as much as your philosophy of life. You know, what you want to find is a specialist, excuse me, not really a specialist, a doctor, a well-educated person whose philosophy of life has to do with the fact that health is a natural byproduct of healthy living, of making proper lifestyle choices. I'm suspicious of you must take this, you must take that as a methodology to create health, because the philosophy of life really is that health is a natural byproduct. It's something that comes from within. It's an inside-out approach. And that the best things that we can do, in fact, is to allow health to happen and not interfere with the process. Stress interferes with the process. Trauma interferes with the process. So finding a doctor, and it does happen to be that chiropractors tend to have a training in that type of methodology. Naturopaths, homeopaths, And again, many medical doctors are actually spearheading the wellness movement because they focus on the promotion of health and well-being. So we discuss, there's actually interview questions of how to find the right type of doctor, how to ask those types of questions. I don't like to feel as if I'm trying to promote one profession or the other, so to speak. It's really up to people to find the right person, and really asking around and getting referrals from people who you know are actually healthy might be a great place to start.
Thank you, Jason.
Yeah.
To bring us home, how can staying healthy make us rich?
That's the great question. There's obviously two ways to that. And we mean richness in all aspects of the words. Let me handle the most obvious one that people think. I believe the number one way that people can in fact accumulate thousands, tens of thousands of dollars in their lifetime these days is to stay well and to fully fund a health savings account. We talk about what those are, where to find one, why you should find one, and actually who they're appropriate for and who they may not be as appropriate for. So there are methodologies because of new laws that have been in fact passed within the past several years. So this is new for most people. It's in fact new to most employers, but it is an increasing trend, and I don't think that most people really understand the positive impact that these types of programs in fact have. But you literally can have a second retirement account that can accumulate tens of thousands, and I'll say if you start early enough, hundreds of thousands of dollars over your lifetime if you were to be able to take your savings on your health insurance and put it into a health savings account for your benefit over time. But I really want to stress the point that richness is freedom. That richness is being able to travel when you want to travel, work when you want to work, love when you want to love, do what you want to do when you want to do it. That to me is what a rich life is all about. It's not just about having lots of money, because there's plenty of people that have lots of money, and I would not call them rich because they have no control over their lives. So at the end of the day, I can promise you, and I think every doctor knows, that being healthy is the most important thing you can have. As we like to say, our health is our greatest asset. The more of it we have, the richer we are. And if you need to understand how true that is, then find somebody who has lost their health. And you'll realize that they will do anything, pay anything, and go anywhere to gain it back once they've lost it.
Dr. Jason Deitch, thank you so much for sharing your knowledge with us.
It's my pleasure.
The book, Discover Wellness, How Staying Healthy Can Make You Rich. Thank you for sharing your wisdom with us on the Wellness Spotlight. This brings to a close another segment of the Wellness Spotlight. Once again, on behalf of the Advisory Health Council, I'd like to thank our special guest, Dr. Jason Deitch. And I'd like to encourage all of you to follow his advice and remember that wellness works if you work it.